Welcome to Nutri Delights, your ultimate source for all things health and food. If you're looking to improve your wellness, make better food choices, or discover tasty and nutritious recipes, you're in the right place. Here at Nutri Delights, we believe that food is not only fuel, but also medicine for your body. We're here to guide you on a journey of mindful eating and holistic wellness, helping you live a vibrant and fulfilling life. Join us as we explore the world of wholesome food and share insights to help you feel your best every day. Understanding GERD, a deeper dive into the mechanism. Many people are familiar with the discomfort that comes from gastroesophageal reflux disease, GERD, a chronic digestive condition where stomach acid moves into the esophagus, causing a burning sensation, commonly known as heartburn. If you've experienced GERD, you know how disruptive and uncomfortable it can be to your daily life. As someone who struggled with severe GERD for over 3 years, I can completely relate to the impact it has on one's health and quality of life. Before we dive into the management strategies for GERD, it's important to first understand how it works and what's happening inside our bodies. The mechanism behind GERD occurs when the lower esophageal sphincter, LES, a ring of muscle located between the esophagus and stomach, becomes weak or relaxed. The LES typically serves as a gatekeeper between the stomach and the esophagus, allowing food to pass into the stomach while preventing stomach acid from flowing backward into the esophagus. This backward flow of stomach acid into the esophagus is known as acid reflux. When the LES fails to function properly, stomach acid can spill over into the esophagus. The esophagus is not built to withstand the highly acidic contents of the stomach, unlike the stomach lining, which is coated with a protective layer. As a result, this acid can cause irritation, inflammation, and even damage to the esophageal lining. Over time, this leads to the development of GERD. The discomfort you feel, such as burning sensations, chest pain, and regurgitation, is the result of this damage. If left untreated, the symptoms can worsen, and over time, they may even lead to complications such as difficulty swallowing, chronic cough, or the development of esophageal scarring. Common treatment: proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are the go-to medication for managing GERD. PPIs work by blocking the production of stomach acid, providing significant relief for most people with GERD. When used correctly, PPIs can improve symptoms by reducing the acidity in the stomach and preventing acid from backing up into the esophagus. They are so effective that they are often used as a diagnostic tool. If your symptoms improve after taking PPIs, it's highly likely that GERD is the underlying cause. However, while PPIs are very effective in the short term, they don't address the root cause of GERD, the weakened LES. PPIs only manage the symptoms by suppressing stomach acid, but they don't strengthen the LES. Therefore, once the medication is stopped, stomach acid may start to flow back into the esophagus again, causing symptoms to return. This can create a cycle where people rely on PPIs for long periods of time without actually resolving the core problem. The challenge of rebound symptoms: the issue with PPIs is not necessarily their side effects but the fact that they don't offer a permanent solution to GERD. When you stop taking PPIs, there's often a rebound effect where stomach acid production increases, leading to the return of GERD symptoms. This cycle of symptom relief followed by symptom recurrence can make people dependent on medication, but it doesn't address the deeper issue: weak LES function. This makes it clear that while PPIs can be a useful temporary solution, they are not a long-term fix. The focus should shift towards strengthening the LES and making lifestyle changes that support overall digestive health, so GERD does not become a chronic issue. Complications of GERD: if GERD is left untreated or poorly managed, it can lead to serious complications. For instance, the frequent reflux of stomach acid can irritate the throat, causing the sensation of something being stuck in the throat or even a chronic cough. In severe cases, the acid can enter the airway, which can lead to asthma-like symptoms or respiratory issues. Other serious complications can include the narrowing of the esophagus due to scarring, bleeding from the esophagus, and, in rare instances, even an increased risk of esophageal cancer. These complications emphasize the importance of managing GERD not just to alleviate discomfort, but also to prevent long-term damage. Lifestyle modifications for GERD: your long-term solution. While medication like PPIs can provide relief in the short term, the real key to managing GERD effectively lies in making lifestyle modifications. These changes focus on reducing acid reflux, improving LES function, and supporting your overall digestive health. Let's explore some lifestyle modifications that can significantly help manage GERD without relying solely on medications. Eating habits to improve GERD. Certain eating habits can aggravate GERD symptoms. Let's take a look at how your eating patterns may be contributing to the problem. Overeating. Eating too much food at once puts pressure on the stomach and can trigger reflux. It's important to eat smaller, more frequent meals to avoid overloading your digestive system. Eating too quickly. Eating quickly prevents your digestive system from properly processing the food, which can lead to acid reflux. Taking your time during meals can help reduce the likelihood of reflux. Late night eating. Eating too late at night can disrupt your body's natural circadian rhythm, leading to more reflux while you sleep. Try to finish meals at least 3 hours before going to bed to give your body time to digest. Foods to avoid with GERD. Some foods are known to trigger GERD symptoms by irritating the esophagus or weakening the lung. While you don't necessarily need to eliminate all of these foods, limiting them can help reduce symptoms. 1. Alcohol and caffeine. 2. Spicy foods and fatty foods. 3. Chocolate, citrus juices, and tomatoes. It's crucial to pay attention to how these foods affect you personally, as GERD symptoms can vary from person to person. Abdominal pressure and GERD. Excessive pressure on the abdomen can worsen GERD symptoms. Activities that increase abdominal pressure, such as sit-ups or wearing tight clothing, can push stomach acid into the esophagus. To reduce this risk, avoid wearing tight belts or clothing that compresses the stomach. In terms of exercise, opting for low-impact activities like walking, swimming, or yoga can help you maintain a healthy weight without adding unnecessary pressure to your digestive system. The role of weight loss and exercise. Excess weight, especially around the abdomen, can worsen GERD symptoms by increasing pressure on the stomach. This added pressure encourages acid reflux. By losing weight through a balanced diet and regular exercise, you can significantly reduce the likelihood of GERD flare-ups. Aerobic exercise, such as walking, jogging, swimming, and cycling, has additional benefits, such as improving cardiovascular health, reducing abdominal fat, and strengthening the muscles involved in digestion and swallowing. Regular aerobic exercise can also enhance the function of the lung, further reducing the chances of acid reflux. Exercises to avoid with GERD. Certain exercises should be avoided because they increase abdominal pressure, making GERD symptoms worse. These include 1. Sit-ups and crunches, which compress the abdomen and can exacerbate reflux. 2. Inverted exercises, such as handstands or headstands, can reverse gravity and make it easier for stomach acid to flow into the esophagus. 3. Heavy weight lifting, which can increase abdominal pressure, leading to acid reflux. Instead, focus on moderate, aerobic exercises that promote weight loss and improve overall health without putting strain on your digestive system. Consistency and moderation are key when it comes to managing GERD through exercise. Moderation and consistency are crucial. While regular aerobic activity is beneficial, overly intense exercise can lead to increased abdominal pressure and worsen reflux symptoms. Starting with low-impact exercises and gradually increasing the intensity over time will allow you to build up stamina without exacerbating GERD symptoms. A holistic approach to GERD management. In conclusion, while proton pump inhibitors, PPIs, can offer immediate relief from GERD symptoms, the long-term solution lies in lifestyle modifications that address the root causes of the condition. These include maintaining a healthy weight, engaging in regular aerobic exercise, avoiding foods and activities that trigger reflux, and taking measures to reduce abdominal pressure. By incorporating these lifestyle changes, you can not only reduce the frequency and severity of GERD symptoms, but also improve your overall health and quality of life. Remember, a holistic approach that combines healthy eating, consistent exercise, and mindful habits is the best way to manage GERD and prevent it from becoming a chronic issue. Thank you for tuning in. If you found this video helpful, don't forget to like, share, and subscribe to Nutri Delights for more health tips, recipes, and wellness advice. We'd love to hear from you. Share your thoughts or ask questions in the comments, and let us know what topics you'd like to see covered next. Be sure to hit the notification bell so you never